presented by Community Health Network.
Well, let's bring in Wish TV medical expert and former U.S. Surgeon General, Dr. Jerome Adams, for today's Health Spotlight. Dr. Adams, it is late summer, and yet again we are talking about a jump in COVID cases. We know there's a new dominant strain of COVID right now. Just how strong is this one, and are you surprised by where we stand with case numbers?
Well, I'm not surprised. We see these spikes from time to time, and we will for the foreseeable future. But as you mentioned, according to the latest data from the CDC, the new EG5 Omicron subvariant, which also is being called Eris, now accounts for the largest number of U.S. COVID infections. More than 17% of all cases in the last 2 weeks have been from this subvariant. The EG5 subvariant has a spike mutation, and that allows it to evade immunity more easily, meaning that when compared to other recent variants, it's more transmissible. Now, Drew, here's the good news. It doesn't appear to be more severe or cause more severe disease, according to a report from the World Health Organization. And the basis for the updated vaccines coming this fall will be the related XBB variants. So it means it should be a good match still.
The list of symptoms is so long over these last few years. We've heard from the beginning that COVID, like loss of taste and smell, was a key sign, but now doctors are telling us that it is not a symptom of the new strains.
Well, remember in the beginning, we didn't have a lot of testing, so unless you were severely sick, loss of taste and smell was a way that many people knew that they had COVID. However, as different variants of the virus have emerged, the types of symptoms most commonly experienced, we've seen them change as well. The risk of losing your smell and taste from the most recent Omicron variants is only 6 to 7% of what it was during early stages of the pandemic. So smell and taste are no longer a reliable indicator of COVID-19 infection. We need to make sure people understand that you can't rule out COVID-19 now if you're feeling sick but haven't lost your taste or smell, taste or smell. But it also means that if you have lost your sense of smell or taste, it's no guarantee that it is from a COVID-19 infection.
Okay. Well, another headline this week, COVID-19 took a toll on heart health, and doctors are still grappling with how to help. They say COVID can have an effect on the heart and the cardiovascular system for up to 1 year.
Yes. So they analyzed records from the Veterans Administration database and found that people who survived COVID-19 early in the pandemic were more likely to experience abnormal heartbeats, blood clots, chest pains, and palpitations, and even heart attacks and strokes up to a year later. There was also another study that showed that people who even had mild cases of COVID were much more likely to develop type 2 diabetes a year out. So the lesson here is that it still is prudent to make sure you're up to date on your vaccinations. It's prudent to avoid COVID if and when and where you can, because many people are experiencing long-term symptoms. You get over the acute illness and you still may have something bad happen to you months or even a year or more out.
Okay, we want to steer away from COVID for our final question, because a new report yesterday shows that the number of suicides in the U.S. hit a record high last year, 49,000 people. You've had a chance to look at the numbers. You follow this as Surgeon General. Why do you think it's so high right now? Is there a solution to help start bringing those numbers down?
Well, truly tragic, as you mentioned. 50,000 almost people took their lives by suicide. Here's what's interesting about that data, Drew. Over half of those deaths had a firearm involved. So as you mentioned, when I was Surgeon General, I put out a call to action because I saw this trend coming before and during the pandemic, and highlighted one thing that we all can do, and that's make sure we're being responsible with firearms if we have them in our home. Make sure we're locking them up, keeping them away from people who may be depressed, or especially from children. We also need to make sure we give people resources. So 988, the new suicide prevention hotline, is available. And I just recently heard this week that Indiana actually is doing better than most states in terms of actually picking up the phone. They have a 95% response rate locally, and we need to continue to build out the infrastructure so that when people call, they can be connected to care. Those are things that we can do right now. Make sure we keep our firearms safe. Make sure we advocate to our legislators and leaders to make sure 988 is appropriately funded and resourced, and make sure that our friends and family know about 988 recent survey showed that many people across the country aren't aware of this new number, which can help save a life.
Yeah, it's certainly worth underscoring. It's as simple as 911, 3 numbers, 988, if you or someone you know is suffering with thoughts of suicide. Dr. Adams, thank you for all of this insight.
Thank you. Have a good evening.
You do the same.